the hospital and healthcare facility. We have two major categories. There's the renewable materials and the non-renewable materials. This is renewable materials are called also the current consumptions or supplies, and the non-renewable materials, those are called the capital or equipments. Renewable materials, those are the supplies that are quickly consumed, for example, cotton wool, syringes, papers, and others. And the non-renewable materials, those are equipments that can last many years and also which must be maintained. An example like microscope for laboratory scales, weight scales that's used to weigh, to check weight, ambulances, vehicles, tables, others. So in management of materials, we have 4 stages where we have to start by ordering, issuing equipment or distributions, and the controlling or maintaining. So by starting by ordering, that is acquisition for materials. Because to start by the ordering, here in ordering, you have to take some to show the technical specification of equipment, and you identify the specific characteristics that you need in order. Storing equipment, that is about the registrations, labeling, and preservations of material and equipment stocks. When you go to maybe on a visit where you perform your clinical practices, you find some the equipments which are labeled, where you find some labels or some different types, and and if you maybe you visit some like the pharmacy, you are going to find some tools that they use in managing their store, where they can use the store cards and also some registers. Even now, we are using LMIS. It is the electronic medical management information system, which is in place to facilitate the management of the store. So issuing equipment, you can't, when the equipment is in the store, you have also to request it, and they supplied equipment to the staff for their use, and the control and the maintaining, it's all about maintenance or repairing. And in maintenance, we have 2 types where we find preventive maintenance and curative maintenance. Regular prevention, that is performed to prevent any breakdown for equipment or material. But for curative maintenance, that is done when the equipment has already broken down. So in ordering equipment, we must make a list of what we need from what we know and about the last use estimation, and estimate the current needs, balance the needs and available resources. That is, when you request materials, it's not that always you are able to purchase it or to afford it, but sometimes you can put some criterias where you can use different, depending on priority, you can prioritize the equipment depending on the priority set. Use a catalog, and also you complete another form of requisition. In making a list of materials, you have to make many lists based on what you think purchase equipments. For example, if you buy much in local shop and the medical thermometer for medical supply stock, can buy paper stationery. For each item, we must specify types. For example, where you have to mention this is it's called technical specification of a material equipment. For example, plastic syringe of 5 cc or 5 mils. If you don't add these 5 mils, they can be different size that you need. Maybe those is for 2 mils, 10 mils, or 20. If you need, for example, the syringe of 20 mils and you order for those only for 5 mils, or weekly or monthly or quarterly, you have to determine that. So balancing the needs and resources. In all services in the world, there is a lack of resources. Reason why we say that the resources of health sector are scarce. We must always balance the needs in those resources, where you have to compare what you need and the amount of money. For example, when the budget is increased or a new program is implemented, but in general, we are forced to reduce those needs to match them with the available funds. Reason why we must make an estimation of cost before completing another form. So cost estimation, here we have like on a sheet of paper, you have to put a column, write articles. When you say an article, that is an equipment, material, or any something in need. Use also term article. These resources, the quantity, both unit price and total price. For example, if you want to make the cost estimation for this, you can put thermometers. It is an article. Sphygmomanometer, that is the blood pressure, which is manual. Stethoscope, you know it, I think. And TC, the quantity, the unit prices. Then here, if you use the good software, you can use an Excel sheet where you can calculate if you have, for example, 150 articles or 150 items. You can calculate manually. It can take you much time. If you use some softwares like Excel can help you to get those calculations as quick as possible. You assume that we have only 15,000. If you have only 15,000, you have to revise this list and determining deleting some items, reducing the quantity until the total cost match with available funds. This is to show you that to make a list and also the prices will help you to determine which, if your total budget, available budget is 15,000, you have to know you can reduce maybe quantities of those items so that item needs can fit these ones, this available budget. Use a catalog. The catalog is a book. Are you following me? Okay, that's good. So, for example, containing the list of items offered for sales in a certain place. We use a catalog whenever you buy things at a distance. The catalog may be issued by public or company or manufacturer, private stock. The disadvantages for using these advantages for using the catalogs that you can purchase material that you do not see. That is another way of determining the list of items that you can need. You are by using this catalog. This is like a book where you can which contain the list of items offered for sales in certain place. So whenever you want to buy the things at a distance, you can use this book in order to help you to make like a purchase order or a command. So another form, this is used by making an order where you can put the name of article, put the number, the name, or designation. You are going to find sometimes we use the name of article, we put designation, or can put also name of item, the types, the unit where the how many, that is about the quantity, and the price of a single unit, or of the price of one item, then we put the total prices. Then you are going to make a summation of all items where you have. If you according to storage is we have all in healthcare facilities or in the hospitals, we have main stock where you will find that is the stock combining all medication, consumables, or medical equipment. New, you have to stock those new or not non-used. The active stock, that is the stock sometimes we are going to find like in the hospitals, there is a main pharmacy store, we're storing the item in general, where they also you are going to find the small stores in different departments, and we are going to find also the stores in like this distributing the pharmacy, which is like dispensing pharmacy, where patients after consultation they can visit and get some medications, or they can get some consumables, like those patients who are admitted, where they can take. That is what we call active stock, because that stock patients, the main users there, those are the patients or the clients who visit the clinic, the hospital, and that is active. But in the main stock, they can make main stock can serve an active stock. Like the requisition can be done once a week or twice a week, depending on hospital policy. So record the entry for new items and record given out articles. And when you are managing a stock, you have to record all transactions. But this is if you make a requisition or you receive some instruments, some consumables, medication, or materials, you have to record when at the reception, and you record them maybe in the store registry or software which is there, and also can also record on store cards. And those which are issued also must be also recorded. You have to maintain and keep the stock book or files, stocks carefully. If you receive new articles on new items, you have, it must be, normally we receive things which are not yet paid. The majority of them, maybe donations can be paid before, but or when is the donation that is a free of pay, of charge, that time there is no need of pay slip or bills, but you have to check at reception when what you are comparing, the what you ordered is the one that they are supplying. And that cross-checking or cross-verification is very important. After signing the reception, I have to, or the delivery, I have to check if the specification done or given at the ordering stage is the same as the material, the equipment contains at delivery. Then you recognize the delivery where you, after delivery note, that is where the invoices are done, but it can be done also on the pro forma invoice before, and also you complete after delivery. After delivery, then you can proceed payment if everything is okay according to ordering uh, request. The recording is done in columns and it includes the date of reception, article, number of items, and the supplier, the invoice number and the packing slip, the quantity received, and it usually take 2 books, which is one book for material and other for equipment. As balance, each item is recorded on the page of the book whenever we receive it. Now, the total stock. And every time we take an article subtracted from the total stock. That was what I was taking as far as you receive equipment or drugs or instruments or consumables. You have to record it on as you have to add on your stock, and at each, also when you issue every item, you have also to record every transaction must be recorded on a store card or non-stock registry, so that to help you to calculate the balance at the end of the day. So put this is how you can record in a storage book. We have date, article, receipt from or off, bill date, where you have made the bill, the quantity received, and at each item, deliver the quantity. That is also where you can receive them, but also you have to supply also the users. You have to put the items that you have given and the balance. And sometimes in a store, for example, if you have medication, you have to consider, have to know the unity of counting. For example, you can have, for example, the tablets. If you have the tablets, for example, paracetamol, and you have the cup, maybe the cup of 1,000 tablets, that time the unit making a pricing for those tablets, and one tablet is not ahangaha mubyumve neza, niba murimo mujera stock ugomba kumenya unit. Igikombe kimwe cy'imiti ya paracetamol kirimo ibinini 1,000, ntabwo umurwayi azaza ngo ahite agura igikombe cyose. Niyo mpamvu unity ya pricing iri very important. Noneho na unity of distribution, niba uri nko muri main stock, ushobora gukonsidaringa cya gikombe cyose, ariko niba uri muri, for example, uri nko kuri rwego rw'igihugu, niba ku rwego rw'igihugu baranguza ibi bashingiye ku all stock in the hand in the pharmacy. Can use also the stock book where you can report the distributed material and equipment stock book. The remaining stock by subtracting the total quantity withdrawn from the stock. This can be done on a daily basis, and each transaction must be, or as I told you, you have to record it in order to make a summary at the end of the day. And when you're giving the handover, for example, if you are managing the stock and want to, the active stock, as I told you, dispensing pharmacy, for example, you have to show the quantity distributed by day. And when you give the handover to your colleague, you have to give the the number of recorded items must, the recorded quantity must also match the physical stock. When we talk about this physical stock, that is the stock which is available in your stock, the items which are available. That's the physical. The physical must be counted, and the records, those recorded one, must also meet the physical. Each item, but you can make some adjustments on items that have been distributed. Ushobora kwirirwa muri stock ufitemo tuvuge items 300, yenda abarwayi bakaza konsoma kuri items mirongo 35 zonyine. Izo 35 zo ziba zifite records z'uwo munsi, ariko izindi ziba zisigaye ntabwo wavuga zose ngo urazereka muzibara, ntabwo byakunda. Niyo mpamvu mufata periode runaka mwese mukagira gute, mugakora icyo bita physical inventory, and iyo physical mukabara, mukerekana situation mutangiriyeho, yenda maybe at the end of the month, ikazabafasha n'ubundi kuzakurikirana uko ibintu bikoreshwa. So this is very important. It is not, if you want to manage well the internal stock management, is better scorecards. You are going to see the scorecards, how is it? But here WHO says that to maintain a proper inventory records, you need a store card and store book or register. Muri stock yawe ufitemo item 200, n'ubundi 200. Ikindi nababwiye kiri very important, and turaza kureba muza yayo nibimeze store card, ariko nuko ugomba kumenya unity of count items and stock room. This is physical count. I was telling you, this is also called physical count or physical inventory. It uses also information from store cards and maybe electronic or paper for monthly stock management. The store card is used at each transaction of any item that you are using. Maybe there is when you receive a material or medication and some consumable, you have to record on a store card. For the stock book or register, that can be used maybe at a interval of 1 month. This can be electronic or can use also electronic or hard, and that can be fit at the when you make a physical count. This can be done for all items of the store that you have to count, and you put the quantity you find when you are counting. So the store card, this is an example of a store card. Store card mwarazibonye mu bitaro, mujya mugera muri stock za farumasi cyangwa muri mu stock y'ibitaro. Nta muntu wagezemo, muranyumva na 3 minutes training about the store card. I told you that you put item, for example, syringe of 5 cc. Unit you are going, the syringe is a name. Unit is 5 mils. Manufacturer can be industry from India or any like Unipharma, like what. Here in the minimum stock reorder level, you can put like maybe 200 pieces. You have to make a reorder. So here you put the date. Aha nabahaye urugero kuri ushobora ku itariki 26 z'ukwa karindwi z'ukwa gatandatu ushobora syringes za 5cc igihumbi. Icyo gihe wazakiriye nta hantu wigeze ziri received from Kifaruma n'aba suppliers bo mu Rwanda cyangwa se Medicel cyangwa se Pyramide, arizo dufite nyinshi mu Rwanda zizwi, cyangwa se wabikuye muri Central Supply y'u Rwanda cyangwa se ku karere. Muzabona ko buri karere ko mu Rwanda kose gafite iyo bita district pharmacy, akenshi ni supplyinga public hospitals n'ama health centers zo muri iyo catchment area. Iyo bavuze catchment area ni ukuvuga ngo ni zone ikigo cy'ubuvuzi kiba kireberera. Catchment area rero y'akarere usanga ari ibitaro bya district. Wajya muri centre de santé usanga iri ku rwego rw'umurenge. Iyo catchment area yayo usanga urwego rw'umurenge ariyo centre de santé ikavaringa. Wajya ku rwego rw'akagari niho usanga poste de santé zirimo zizaba ziri ku rwego rw'akagari rw'imivurire. Izo nizo rero uko bagenda bazita ku catchment area. Ariko iyo ugiye nko mu bitaro bya referral hospitals biba bikavaringa hafi abantu batandukanye n'u Rwanda rwose cyangwa se n'abanyamahanga bakavade nta n'ikibazo. So wagenda ku itariki 26 z'ukwa karindwi twakiriye syringe igihumbi za mililitiro 5, urazandika muri quantity received. Quantity issued icyo gihe ni 0 kuko nta muntu wafashe uwo munsi uwo muti, wayakiriye gusa. Balance ubwo nta bintu bireba, n'ubundi ni ya yindi wakiriye ugashyiraho lot number, kenshi riba ari nimero z'uruganda wawukoze, ukanasinya wowe yakiriye ukora muri farumasi. Byarangira noneho ku itariki 27 yenda unit ya maternité ikaza gushaka inshinge bambizura syringe za 5cc. Icyo gihe urandika muri akoroni ikurikira, shireho 27 kuri date, imiti aho amasyringe aho yavuye ni hahandi harazwi. Izi records ziri important kubera ko na Food and Drug Authority mu Rwanda ikomeza gukurikirana nka lot y'umuti wateye nk'abana ibibazo. Iyo itanze communique ni ya lot yandikamo muri ya communique mujya mubona bavuga yenda ngo paracetamol iyi ngo ntabwo ikiri ku isoko ngo ibiki, nuko baba babonye utagira ubuziranenge. Ya lot rero ni very important kuba recorded no kuri store card. Store card ni ikoreshwa muri active stock. Buri movement zose zikozwe muri stock zandikwa kuri store card y'umuti, kandi buri consumable bitewe na unit yayo igira ikarita yayo. Ni ukuvuga ngo mu syringes, kuko syringes zifite amasize atandukanye, ushobora kugira nk'amakadi arenze 5 yo kuri maserenge gusa. Hari ya yenda 2cc ya zira zo mu ma insulin, zira za 20cc, za 60cc, za 10cc. Izo buri yose igira kadi yayo kuko ntago ziba zifite size imwe. Nizo rero bita unit, ni unity of count cyangwa se unity of representation. So kuri corona ya kabiri ubwo umuntu wo muri maternité aje gutwara syringe igihumbi, urazandika numara kuzimuha urandika hehe, urandika date 27 zakiriwe hahandi n'undi zivuye muri Kifaruma, issued to maternity staff, quantity received ni 100, quantity issued ni 100, balance ubwo ni cya gihumbi urakuramo 100, recording muri ya corona ikurikira. Lot ni yayindi gumaho, lot zahinduka ari uko wongeye kurisivinga izindi syringes ziturutse ahandi hantu niwongera kurisivinga izindi new syringes, izindi syringes zo kuri ino zitaha niho uzagira lot izahinduka, signature uyishyireho hariya, ariko lot ishobora no kudahinduka, ushobora gukora requisition ugasubirayo ugasanga baracyafite ya lot. Niyo mpamvu ugomba kureba lot kuri reception igihe wazakiriye, ukareba lot izifite ukabishyiraho. So that is how we do it. The store card. Do you have a question on this? This is practical issues that you have to visit the pharmacy stores and see how the store cards are used. If you have a question, you can ask. You all is very clear. Abazakora muri farumasi iyi muzayikoresha cyane. So ninde wasubiza? Hari umuntu wavuze ngo igihe waba wakoze era ngo wabigenza ute? Ninde wamusubiza? Umuhoza Becca, can you clarify your question?
Okay, thank you. Ikibazo mfite ni uko ushobora gukora iriya store card ariko wakuramo amayera, wenda ukaba washyiraho quantity zitari izo umuntu yafashe cyangwa se ugashyiraho izo yafashe. So in case ugiye gucollectinga that kind of mistake, urongera ugakora indi store card cyangwa uca umurongo ugashyira hasi cyangwa wandikaho ko ukoze era kuri iyo column cyangwa se iyo aho hantu nyine ukoreye error, cyangwa se store card yose bifuye urongera ugakora indi nshyashya.
Ninde wamusubiza? Abamusubiza? Okay, Becca yabajije mvango niba ukoze era ukayibona ako kanya wahita uyikosora, ariko iyo hari igihe usanga era warayikoze ukabibona muri iriya bita physical count. Physical count ushobora kureba ibintu uko wagiye ubibara, uko wagiye ushyiramo amabalance, ugasanga balance ntizirimo guhura, ugasanga wamara kubara ukwezi yenda gushize ujye gukora general report y'ukwezi muri physical count, ugasanga balance wari usanzwe ufite ntirimo guhura na balance wowe ubaze ukabona. Icyo gihe ubikosorera muri physical account, kuko physical count iyo uyikoze buri gihe even you wandikisha na red color n'ikaramu y'indi color idasanzwe niyo usanzwe ukoresha muri record. Physical rero count wakoze niyo yongera guha umurongo, niyo iba reference y'ibintu ugiye gutangiriraho uko kwezi, nibura byo biba bikosoye. Ariko akenshi nk'ubu ngubu n'urugero, nshobora njyewe kuza nkavuga ngo nguhaye nk'uko nabivuze kare ku maserenje, ntatanga serenje 100, nkaba narakiriye serenje 1000 uyu munsi, ejo nkatanga 100, ejo bundi nkatanga 200, ariko stock ugasanga abantu barahinduka, yenda hari utara recordings. Njyewe ntabwo nzagiza ngo mbare za serenje zisigaye kari 1000 kari 800, ndaza kuko ndebera kuri stock bihanditse akaba ari byo ntanga, kuko ntabwo wajya guhereza abantu imiti abakiriya bari aho ngaho imbere ngo ugende uri coding ikintu cyose ako kanya, aba bambe ubara usubiramo bari ibintu, hari ibintu ari byinshi cyane. Niyo mpamvu store card yo iguha picture yo kubasha kumenya uko movements zirimo gukorwa, ariko ntabwo usubiramo ngo ugende ubare buri cyose ako kanya. Niyo mpamvu wiha nibura buri kwezi ukabara byose, ukabara ibyo ufite, ukongera kugira baseline y'uko kwezi ugiye gutangira. Era rero uhise uyibona ko wayikoze, ushobora kugira kubigaragazaho ugacamo nk'akarongo ku buryo bitaza kugaragara ko ari umwanda, ariko ugahita ujya mu koloni ikurikiye ukabyerekana, then ugakomeza ukabikorectinga, ugakomeza ubashije kubibona ako kanya. Ariko niba byarapfuye nka mbere, kuko hari igihe muba mufite nka items zikoreshwa cyane. Niba zikoreshwa cyane rero, urugero nko muri dispensing ntabwo wakoresha store card kubera movement ziba zihari, ariko muri main stock, muri stock centrale y'imiti, store card ziba zigomba gukora. Ko kuri dispensing kenshi bakoresha ikaye ya consommation, wandika ibyo wagiye uha buri murwayi, ku buryo noneho mbere y'uko utaha nawe ukora toto y'ibyo wahaye umurwayi. Ariko muri muri main stock is very important to have it. So hari umuntu rero wanditse ngo why do you need this store card especially in our career apart from being in the pharmacy. Uyu ni Beka Muhoza nawe. Beka Muhoza nacyo wakongera nawe ukakibaza nacyo neza tukagenda.
Yeah, it is clear now. Nabyumvishe gusa nyine I just want to know, we are nurses and midwife and store card, because urumva umuntu udocumentinga ko card n'undi ni umuntu uri muri pharmacy akora ibintu bimwe n'ibyo ngibyo. So as nurses and midwife, why do we need this store card? Haba hari ukuntu tujya tuzikoresha sometimes, cyangwa se umuntu ashobora kuzapurika in our daily life cyangwa lifestyle dukoramo kwa muganga. Nyine why do we need it apart yo kuba waba uri muri pharmacy cyangwa se uri in charge of a stock manager cyangwa se undi muntu wese. Yeah, thank you.
None se kamubaza utaragenda, isomo turi kwiga ni irihe?
Nk'uko Rebecca yarabaje ikibazo, mwarimu uvuze yuko iyi stock card kuba farumasi nibo baba bayifite mu gihe bakira imiti cyangwa se izindi material. Rero ntekereza yuko nk'abanasi aho twahurira nayo umunasi ashobora kuba ari in charge ya service. Igihe agiye kuzana ibikoresho kuri farumasi, ashobora kuyifata akandika ibyo ngibyo izo material avanyeyo, akandika ingano yayo, quantité, akandika balance na lot nk'uko mwabitubwiye. Ntekereza yuko aho ngaho ushobora guhurira nayo kugira ngo abone uko managinga izo material aba yabonye. Thanks.
None se nkawe nk'umuntu uri kwiga health facility management, kuyobora ikigo, niba uyobora ikigo, kuba izi resources zaba well managed byakumarira iki?
Icyo byamarira ni uko bigabanya izo material zikenerwa. Ubwo uko umuntu azikontorora akamenya izasohotse ni izi ngizi, izakiriwe ni izi ngizi, bigabanya navuga izipfushwa ubusa cyangwa se izikoreshwa nabi, niko navuga, kuko bituma umuntu amenya gucunga izangiritse, ese ibyangiritse bari buze kongera kubikoresha ute kugira ngo bahagabanye. Ntekereza yuko umumaro wabyo ni ukugabanya quantité y'ibisohoka, ahubwo nabyo bindi byasohotse bigakoreshwa neza kugira ngo hatazamo gusesagura.
Thank you very much. Uzanyibutse nkongera amanota 3, sibyo? So resource management nicyo kintu cy'izingiro kinini ufite muri management. Bakugize umuyobozi w'ikigo nderabuzima, urayobora ikigo, ubaye nka director wa nursing w'ikigo, ntuzi nuko imiti bajere, ntuzi uko ibikoresho babijera. Uri titirere w'ikigo nderabuzima, ntuzi uko bajera ama ecograph ari mu kigo cyawe, za microscope zo muri labo, ntuzi iki. Ikintu kinini cyane muri management y'ikigo ni resources zirimo. Resources twahereye ku bantu, tureba uko ugomba kumanaginga abantu, none twageze ku bintu. Noneho ibintu byinjiriza amafaranga ikigo ni ibiki? Ni imiti, ni iki? Abantu ntibabikoresha nabi, hakaba wastage. Niyo mpamvu abantu babura, ugasanga nta PBF bafite, nta kintu bafite na kimwe kubera gukoresha iki? Ararangura imiti, yayiranguye amafaranga, ariko bikarangira imiti yose abantu bayigurishije ntubimenye kubera ko utigera uyikurikirana uko iba managed. Wakiriye abarwayi 50 bafite malaria, bakoresheje ama backstars ya Quariteme 200, wicara aho ngaho rero ngo umuyobozi, ngo ikigo kiri kugenda neza, kiraraninga. So it's very important now, and as you know, nursing is a multidisciplinary profession. Nursing ntabwo irimo gafuka kamwe. Nursing is very complex, muri leadership, muri research, muri education, muri management, nkuko nabivuze leadership na management, muri clinical service, muri community enhancement, nta na hamwe mwarabyize mu wa mbere. Role y'umunasi is not limited only on clinical activities, is beyond. Thank you very much, Lucian, for your clarification. Hari undi afite ikibazo aha ngaha, addition cyangwa se ikindi? So let's continue. This is the stock book where I put this book can be, as I said, I told you, electronic, where I can use LMIS, electronic medical record information management system. There's item name, quantity, unit requested, date requested, quantity received, quantity date received, lot, and expiry date. This is example of stock registry. Delivery order is an official form of which you enter the data of distribution, article given out, quantity, book page, registered, where it is will be used, the set of service center or any department. The chief usually responsible for the service, nature of the person responsible for its use, and who signs the delivery that become responsible for that materials. Inventory now. Inventory is defined as a list of equipment found in a certain place. Each service of health unit maintains and keeps an inventory and of its non-renewable assets. It's new equipment that's delivered must be on its inventory. This inventory is done periodically to check the stock and its use. That is the checklist that is help you to inspect the equipment of service by ensuring that it is there and comparing on the inventory. And the frequency of this control depends of the nature and varies according to their fragility, to how their consumables are long lasting. So verify regularly consumables products to prevent waste and abuse. The durable equipment such as beds, tables, chairs are inspected once a year, and equipment machines that may deteriorate should be inspected more frequently and more regularly. This inspection is like preventive maintenance and must be done on a regular basis, depending on the fragility of equipment. The detection and interpretation of gaps. This is the difference between what is reported and what found. After inspection, you can show an example. If there is now there are now many carbofish in a laboratory. This is fish that is used in a gram staining. This fish scene is used in a gram staining in the laboratory that 3 months ago, and there is no order on that product. This is the gap. You have to detect, interpret the gaps which are in management of these items. In laboratory services, we will find that the reagents that are used to make some laboratory exams are needed on a regular basis, and it must be supplied also or monitored as far as possible according to the patient volume. So in drug management, the first part was about equipment, materials, and consumables. Specifically on a drug, this is, as you know, medication. Drugs are called also medication or medicines. They play important role in life saving and also improvement of health status. When they are poorly managed or irrationally managed, they can lead to wastage of resources, prolonged suffering, death on loss of confidence in the healthcare system. And reason why proper management translates to a disease-free and economically productive community. And both inpatient and outpatient need to receive safe and efficient efficacious on affordable medicine. Not only that, moreover, abantu bose bagomba kubona imiti kugira ngo ubuzima bwabo buve mu burwayi. Niho mpamvu ubona hari abantu bahora ku miti bafite ama NCDs, izindi chronic diseases, and we need now the rational use of those medication where we have to solve the problems of our patients. This can start by prescribing and dispensing. Umuntu akeneye arufite ikibazo, umuntu akeneye ufite abarwayi 200 ku kigo nderabuzima cyawe bari ku miti y'ama antihypertensive, and bafata ubwoko tuvuge 5 bw'imiti, kandi buri kwezi abantu bagomba kuza bagafata imiti. Noneho muri incident rate, new cases ugenda ugira buri kwezi, nazo zigaragaza ko hari new cases ugenda ubona nibura 20 z'abarwayi bari baye confirmed kuri hypertension. So ibyo bizakumarira iki kumenya izo patient volumes cyangwa statistics? Ziragufasha guplaninga for the right quantity that you need according to the needs of patients that you have. Otherwise, uzakora requisition y'imiti abarwayi nibaza bayibure, cyangwa se ukore over requisition, stock yawe usanga utangiye kugira ama expiries, imiti igenda expiringana kubera ko itaba well consumed. Reason why the management of stock is very important to know. You have to kugira ngo ubashe kumenya iyo ntuza zo movements zose, niyo abarwayi bakeneye bazaze ntibayigure, kandi nawe ntuzagire stock iri. So a pharmacy is an act of preparing and dispensing drugs, or it can be a place where drugs are sold or are stored. Active principle, I think you know, that is an ingredient that is actively which is involved in that therapeutic. An excipient, that is like an inert substance that is used as a diluent or vehicle of a medication or a drug. Dosage is that the quantity of an active principle. I think this you know. This can be taken or absorbed at any one time. Dose is just a quantity of medication or medicine that is prescribed to be taken once. Pharmaceutical form, that is the combination of the form which a medicinal product is presented by the manufacturer. Concentrated solution, as you know, that is the solution that contains a large amount of a solute relative to the amount that could be dissolved. So in medication nomenclatures, I think you had this, the causes, the brand names, generic names, chemical cause name, essential drugs. The brand name, that is the name given by the manufacturer, is when you find some marketing on a market, you find that medication are all the pharmaceuticals product are marketed under their brand names. The generic name is the approved or non-proprietary name of the drug. It's generally the national non-proprietary name given by WHO, and niyo muzagenda mwumva ngo umuti ni generique, ngo specialité, usanga izina riri generike kenshi ni izina riba riri rusange ritahawe n'uruganda rwakoze uwo muti. Niba urugero paracetamol ikozwe imwe mu Buhinde, indi igakorwa muri Europe, indi igakorwa muri US, uruganda rwa discoverinze uwo muti ushobora kuba ari muri Europe, ariko abana n'Abahinde bashaka gukora uwo muti, urwo ruganda rwawukoze rugatanga iyo formula yayo, bakayikora bagakora uwo muti, icyo gihe riba ryamaze kuba common name. Ariko bo bawukoze bwa mbere bashobora kuba bafite izina ryayo riri special name bahaye uwo muti, urundi ruganda rudashobora kwitiza ngo bikunde. Chemical name yo ishingiye kuri rules and nomenclature of chemical compounds. Ibingibi nabyo mwarabyize murabizi. Essential drugs rero nizo bita imiti cyangwa se formulary list. Ni liste y'imiti igomba gusatisfyinga priority ya needs z'abaturage mu gihugu. Ubu natwe mu Rwanda ufite iyo bita, mujya mubona, sinzi namubona nko kuri, nimujya kuri website ya Ministry of Health, www.moh.gov.rw. We're going to find publications, find the essential drugs list, around 185 medication list of medication that are set or identified as the essential drugs for Rwanda population. Iyi ni liste y'imiti bazita medicament essentiel mu Gifaransa. Ni imiti ikoreshwa cyangwa se imiti y'ingenzi mu gihugu, ishobora gukoreshwa na rubanda rwose, buryo ibita mu buryo budahenze, bose bashobora kuyigiraho accessibility, kandi ishobora correspondinga ku ndwara nyinshi abaturage b'u Rwanda bafite. So iyo miti rero, those are relevant for the common disease and the majority of the population, the country or the community in general. Buri gihugu rero cyose kiba cyari identifyinze iriya essential drug list. So the qualities of essential drugs igomba kuba iri effectiveness, that is very important. Safe, must be safe also. Be used by the majority of patients without creating toxicity and everything. Must be good quality, where it must be easily during handling, and when they are improperly stored, it can also resist. That's they are giving some examples like acetylsalicylic aspirin tablets, where it can be used crumbled into powder when exposed to humid atmosphere, for example. It must be also one of the exclusion. This medication also can have few side effects and also must be affordable. If it's essential drugs, the prices must be low or less, and that will help to enable both the poor or the rich people can afford it, or poor in the country. And also the major problem in developing countries, the lack of financial. This may appear to be the contradiction for this, but that's the quality. Abantu bicara rero bagahitamo iyi miti as essential medication, baba bashingiye ku bintu byinshi, ariko harimo cyane cyane indwara zikunda kugaragara, ubushobozi buhari bwo kuvura, bijyanye na experience na trainings z'aba personnel bahari, financial resources. Iyo ugiye mu Rwanda abaturage benshi bavurirwa ku rwego rwa health centers cyangwa se on second level facility nk'uko nababwiye muri health system yacu. Usanga rero niba ari umunasi A1 cyangwa se A2 cyangwa A0 ikigo nderabuzima, urareba se training yabonye afite cyangwa se bazana biriya tubonye muri ziriya factors, abaturage bazabasha kugura ubuhe muti muri antibiotics yenda tuvuge zivura UTIs, bakarashiramo yenda tuvuge antibiotics nk'eshatu. Muri respiratory disease, maybe upper respiratory infection, bakareba naho antibiotics nk'eshatu cyangwa ebyiri bashiramo, umuturage ashobora ku accessinga, kandi no mu personnel wese rwego rwose rw'igihugu yamenya kumanaginga amadoze y'uwo muti n'ama side effect n'izindi complications zava ku uwo muti. Icyo gihe bigaheraho babasha uwuhitamo. Financial resources nayivuze, genetic, demographic and environmental also factors must be taken into consideration. Essential drug rero ifite principles nuko a limited number of drugs nizo zikenewe kugira ngo zibashe gufasha abaturage benshi b'igihugu. Ikindi nuko iriya miti ishobora gukoreshwa gukenerwa igihe bitewe n'ubwoko bw'indwara cyangwa se na level ya health care mu gukoreramo na training abantu bavura bafite, noneho n'ubushobozi aba prescribers of course baba bafite muri knowledge no managing iyo miti. There is also careful selection wise procurement, kanareba ko hari effective distribution and rational use for people to have access to essential drugs. Kuvuga ngo rero imiti iyo yahiswemo neza bakayihitamo neza, procurement ikabera ku gihe, distribution ikaba neza, n'ikoreshwa ryayo ikaba neza. Niyo mpamvu mubona for example n'imiti y'ama program kazana HIV, imiti dukoresha ya HIV mu Rwanda ntabwo ari imiti, ntabwo ariyo bakoresha i Burayi, ariko bitewe n'abaterankunga bavuga bati mu rwa HIV mu Rwanda dushaka ko atarenza amadolari yenda tuvuge 10 anywa imiti. Icyo gihe barareba muri ya liste y'imiti yose ihari, bakareba iyo bahuza bagakora protocol yo kuvura HIV bashingiye kuri kiriya kintu twamaze kureba cya essential drugs. So the management of drugs is very important because they save lives and improve lives, and also the trust and participation in service, and also drugs are expensive. The management cycle of drugs, this is, you start by selecting the medication that you need. You are going to procure those medication. After procurement, we are going to distribute this medication for use, where we need many on a distribution, we need many things, where we need some policies, the quality requirements, product registrations, patent registration, importation requirements and taxes depending on the level, health rights, and access to treatment. And on the use, this is the service users where they use medication. This is the cycle. The user determine the select what he needs to use depending on the services offered. That selection, they are going to make order, and after order, they are going to distribute different departments for use. Excuse a bit. Okay, so this is the cycle. We talked about this. When we go to drug selection, that is a process where we decide the type of need product. And this is up to 70% percent of pharmaceuticals in the world are duplicate and non-essential. And the availability of so many drugs is confusing for professionals and leads to inconsistency in the practices. As you go, you can namwe iyo mwicaye aho ngaho ku ishuri bakabigisha pharmacology, general, specialized, what different, muragera kuri tere mugasanga imiti iri ku isoko nko muri private sector iratandukanye cyane n'iri muri leta. That is why there are many drugs and also having different names, and those different designation will sometimes confuse people in their practices. And the large number of non-essential drugs and decrease the purchasing power. Drug selection can lead to better supply, more rational prescribing, dispensing, lower cost, can be more rational patient use. And you have to be careful. So careful selections has the cost implication and also has the clinical implication. The criteria for drug selections, there is a relevance to the pattern of prevent diseases. Nimugera mu bitaro, mumaze gukora muzasangamo kugira ngo ibintu bigende neza n'ikigo cyawo kijere neza. Let's end up my health center level where you find maybe there are no committees zijera imiti, usanga kenshi hari iyo bita pharmacovigilance committee notifying some bad events ziba ku miti. Events zishobora kubaho, ku muti ushobora kuba mu ma side effect yayo akagombye gutera, ukabona abantu habonetse izindi side effect zirenze izo ngiyo, uwo muti batigeze bagaragaza ko iyo side effect yabaho, iyo ngiyo niyo bita adverse effect, igomba kuba reported at the Ministry of Health kugira ngo bakurikirane uwo muti. That's called the notification of adverse events of a medication. There is a relevance then to the pattern of prevalent diseases, the facilities, the diagnostic facilities, treatment facilities, physical facilities for distribution, and other facilities, training and experience available to staff, drug product owner in which safety, quality, the availability, and stability are available. So possibilities of easy and prompt procurement and local manufacturer, drug product with widest possibility coverage for prevailing diseases, and drugs with affordable costs by considering total cost of treatment. I think you are following. When two or more drugs seem similar in the above respect selection, above respect can be based on the most thorough investigative drug and the drugs that which offers better patient compliance and drugs which are locally available. This is the criteria of selecting the list of medication to be supplied within the organization when there is two or more drugs which seem similar in that aspect. So the steps for drug selection, it's better to have drug selection committee. In hospitals, you are going to find DTC, it's a drug and therapeutic committee, Second one, determine the prevalence problems and patient characteristics. Ugomba kumenya ibibazo abantu bakugana, ese bafite ibihe bibazo by'ubuzima, bazakenera iyihe miti. Ukadetamininga problems that may be treated in the level of drug selection. Choose the drugs to be used for these problems. You're going to structure the list. You introduce the list of drugs to its professionals, of institutions, and other concerned bodies, updating this list of drugs. It's very important by paralleling preparation of drugs list with development of formulary and standard treatment guidelines. The source of drug information can be primary, secondary, and then tertiary. On the drug quantification, that is a process of determining the amount of the product needed for the purpose of procurement. Imiti yose uba ukeneye kugira ngo uyigure niyo bita drug quantification. Drug quantification kugira ngo igende neza igomba providing a shortage. The shortage of medication can lead to outstock. Mujya mwumva ngo imiti ngo yabuze ngana ngo ntayihari, barwaye bastragolinga nose bajya hatandukanye. Ikintu ugomba kwevoidinga ni overstock, kubika ibintu byinshi bikazarinda bihangirikira cyangwa se biba expired. Expiration, and I think you know it, that is to exceed the date of that's it, like a shelf life, the shelf life, the expiration date where the drugs can be used. Itariki yo gukoresha umuti irangiye, icyo gihe umuti uba disposed cyangwa se ukajugunywa ugatwikwa. Appropriate drug and yes, I have talked about this. Indicators for poor quantification of drugs. There is shortage of drugs, imiti ikaba mike, cyangwa ugasanga stock iruzuye itazaba konsome ngo irangire, cyangwa se ugasanga abantu barandika imiti ku buryo butameze neza, cyangwa se ugasanga imiti budget ikoreshwa imiti ntabwo ikoreshwa neza, maybe nta muntu uyikurikirana, umenya ngo wahombye cyangwa se umenya ngo wungutse mu miti. Ikindi ni uko haba iki na suppression yo kongera gusaba wa muti. Hari uburyo bune rero ushobora gukantifiya imiti kugira ngo werekane imiti ukeneye kuzodaringa, aribwo bune unda gukoreshwa. Cya mbere ushobora gukoresha consumption method, ya kabiri ushobora gukoresha morbidity methods, ya gatatu ushobora gukoresha proxy consumption over adjusted consumption methods, ushobora no gukoresha iyo bita service level projection of budget requirements. This is the 4 general methods that you will use when you are quantifying the quantity of drugs needed to procure. Selection of the appropriate quantification methods requires considering ugomba guhitamo ubwoko bwa quantification wakoresha muri buriya bune ushingiye kuri advantage and disadvantages, ushingiye kuri conditions under which each method can be applied, ushingiye kuri sets of data required, bashingira kuri organization of drugs supply system, additional purpose, and additional purposes. A as the conception method, it involves using records of past consumption on individual medicine, where you can assess the previous consumption on different records that you have. Can be used under the following conditions. If you have an adequate fund, acceptable pattern of prescribing, if you have adequate and uninterrupted drug supply, good stock management, and low level of wastage or losses. Iyo bita consumption method shingiye ku bintu abantu mugenda mu konsoma, wabishingiraho igihe hari izi conditions. Ugomba gukora iyo bita dataset irigizwe n'ibi bintu, data zabaye z'imiti yabaye konsome mu gihe gishize, liste y'imiti yose, ukanagira na budget iri assigned kuri pharmaceutical side. Muri quantification rero steps ukoresha ahangaha, reviewing liste y'imiti na za pack size n'ama prices, selecting a period yerekana consumption ya buri muti. Icyo gihe record consumption wanye niyo bita opening stock, teranyaho drugs received, bakuramo closing stock. Opening stock ni stock watangiranye, ugakuramo stock ibyo wakiriye, ako ugateranyaho ibyo wakiriye iyo period, warangiza ugakuramo stock usigaranye at the end of that period. Icyo gihe ugira icyo bita recorded consumption. Iformula murayumva, ibi ubikarikira at each drug. Naho waratangiye ufite serenge 500 kwezi ugitangira, ukakira serenge 1000 muri uko kwezi, utwaye 1500, ukawushoje ukwezi ufite stock 200, ubwo uzafata 1500 uremo 200, urumva wakonsomye 300 zonyine muri uko kwezi. That is the formula that you have to use for calculating the recorded consumption. Consumption, you can also calculate the consumption adjusted for the stock out. Stock out also can be a thing, and you calculate how the stock out if any. You are going to take the recorded consumption times the period in the calculations. This can be in days or month, divided by period in stock. This is that is in days or month. This is how you are going to calculate the consumption adjusted for the stock out. And the wastage and the losses, that is expected changes in the consumption patterns. If you have, for example, you can have some wastages and losses, and that you didn't notice noticed during your progress. And when you make a physical count, we are going to see that happened. And you are going to compile the centralized quantification if they are applicable, or you convert the quantity obtained to the required pack size. Or you can also estimate the cost of the drug quantities that are required, and you finalize the cost needed, and you compare the cost needed, which is need, demand, with the budget allocated. We are going to make adjustments, or you make what you call a reconciliation. To make the rational adjustment, you can use the Venn analysis, ABC analysis, or can also make therapeutic category analysis. Additional points for on consumption methods that alternatively the drugs quantity can be calculated using an average monthly consumption, the lead time, and the safety stock. And then you are going to find that the quantity to order will equal to average monthly consumption times time plus procurement period. And you are going to find, and you add the safety stock. Here you are going to consider the stock on hand and the stock on order, where you have the quantity to order, which is average monthly consumption times lead time plus procurement period plus safe stock minus stock on hand plus stock on order. Always you consider adjustment for different reasons. Before talking on this, let us explain to you some definitions. There's some terminologies that we use in stock management. We have the maximum level of the stock, which is the maximum level of stock you can hold. That you can't go beyond. This is what we call maximum level. The minimum level, that is to trigger the order of an item. If you reach the minimum level, this is a period where you have to make a reorder for that item. It's not imperative that you make an order of all items which are in your stock, but make it depending on this minimum level of each item. When what we call review period stock level, this is amount of stock needed between reordering. That is what we call review period stock level. Safety stock level, that is the buffer stocks kept on hand against the stock out. This is safety stock, is very important. Stock de sécurité barayita ni stock ugomba kuba ufite muri stock yawe kugira ngo avoidinge cyangwa protectinge ko haba stock out. This can be calculated depending on consumption rate. Lead time stock level, that is the level of stock used between the time of ordering and receiving. If, for example, you order usabye ibintu uyu munsi, uzabibona itariki 20. Ibi iyo stock ukoresheje mo hagati muri iyo minsi utegereje ko bazakuderivaringa niyo bita lead time stock level. And emergent stock level, this is the level of stock that triggers an emergent order. Hari aho ugera ukabona ko ibintu byageze muri critical la requisition d'urgence, iyo niyo bita emergency stop. So if we go back, yeah, we have talked about consumption methods. These advantages, this consumption is just fast choice for quantification because when you give the reliable data, the consumption method will be nice and it requires a less detailed calculation and is useful for facilities where his problems are numerous and drug treatment is very complex. And it shows also stock management problems and encourages improvement. And there is no morbidity data and treatment schedule needed. These are the advantages that is the reliable consumption data may not be found, can perpetuate also an irrational use, and may not be helpful for reviewing prescribing a drug use. It can be also less appropriate if they have been long stockouts, high drug wastages, and the losses. It doesn't encourage good morbidity reporting. Morbidity method. The first one, as I told you, have 4 types. We finished the consumption method. And this, for morbidity, as you know, morbidity is a disease, it's a condition. It estimates the need for specific medication based on expected number of patients who attended, no incidence of common disease and standard treatment pattern. There is also the incidence of common disease, and there is standard treatment patterns for the disease considered. The assumption is that service providers will adhere to established treatment guidelines. The conditions are available consumption data incomplete or unreliable. Prescribing patterns are inappropriate. The budget is insufficient. And the health facilities or service concerned are new or expanded or contracting rapidly. This is where you can use these morbidity methods. Datasets must have the drug list with pack size and pricing. There is a complete patient morbidity profile where you have complete data about the types of diseases what the conditions that patients have. And there is a standard drug treatment guidelines or schedules, and there is also pharmaceutical budget. Here you start by, when you are doing the morbidity quantification of drug needed, you have to specify the list of health problems. You establish the list of drugs to be quantified with pack size and the price of data. You establish standard or average drug treatment schedules for each problem. You select the period to review morbidity data. Determine the number of treatment episodes for each health problems. The treatment episode is a patient contact, which is standard contact for which a standard course of drug treatment is required. The steps to follow this: you obtain the total number of patients contacted by these problems, defined in the average treatment schedule. Within his programs, it varies with these variables, and you are going to determine contacts for which a standard treatment schedule is required. and you calculate the quantity of drugs needed for each health program. You combine the estimates for each drug for various health programs into a master procurement list. You adjust quantities to cover for health problems, for wastages, losses, filling the pipeline, the stock order. And you convert quantities to the pack size, estimate the cost of drug quantities required, then finalize the costs. You reconcile need with the budget. Those are the steps to use when you are using the morbidity quantification of the medication that an organization or a health institution need to cover the patient needs. Additional tip always make adjustment for different reasons. You can make also other adjustment where you have total number of patients. There is children and adult. Here you can put the percentages. The first line medication, their percentage, alternative regimen, the percentage, first line regimen, put percentage for adult and children. And this percentage also can help you to determine where to start. Its advantage is it does not require consumption data. It can be used for review of drug use and prescribing. It can be used also estimating need in new and scale up or disaster assistance. It can be also motivates reliable morbidity recording. These advantages is that detail. Are we together? Is it clear for you? Okay, let us use only in 30 minutes. I will let you falling hardly. Why is it hardly? Easy. I think this is very easy. Maybe you are concentrated but not following hardly, maybe. So we are talking about quantification of drugs. Ushaka kumenya imiti uzakenera mu kigo cyawe, uzaba uri umuyobozi, yenda so uzabikora abatekinisiye bawe ne babikora, you have to verify and give them guidance. Uzamubaza kubera iki uhitamo gukora requisition ya za amoxicilline 10,000 buri kwezi, za penicilline V, I think you know it, kaka 2,000, extensiline ntuzane n'imwe, maybe ampicilline ukazana 800. You have to show why. Ibyo rero nibyo turimo twiga, method that you have to use to quantify the drugs or medication needed within an organization to avoid the shortage and also to avoid the overstock, which overstock can lead on expiries. So disadvantages of morbidity, ushobora gukoresha rero uburyo ukoresha ureba ibyo abantu bakonsomye, buri muti bagiye bakonsoma period ni angaho, naho ushobora kureba noneho ubwoko bw'indwara bukunda gufrekanta ikigo, sibyo nibwo turi. And it requires detailed calculations. Standard treatment may not really be used. And the fourth one is what we call proximity and adjusted consumption. That is used It uses non-consumption data from one system called the standard, and it estimates the drug needs in a similar or expanded system known as the target. Can be used when neither consumption method nor morbidity methods are feasible. And this adjustment can be based on population coverage, where you have to calculate the drug use per 1,000 population and service level to be provided. Does drug use per specified patient case or inpatient admission? We use a proxy by adjusted consumption method. You have to select the standard system for comparison or for extrapolation. Then you develop the drug list. Third step is to establish the time period to be covered in the review. Then you are going to review records from the standard system to compile contact or population data. You establish the denominator and for extrapolation. This is the standard consumption rate, where it equals the standard adjusted annual consumption. You divide by number of thousands of contacts or inhabitants that you have in your organized in your catchment area. Here, you can extrapolate the standard system consumption rate by the target, where you can calculate the target consumption as standard consumption rate times number of thousand contact or inhabitants. You adjust for expected losses and you estimate cost for each drug and total cost and make the adjustment. The fourth one, which is the end, quantification of drug method, drug quantification method. This is the service level projection of budget requirements. Here you use the average drug procurement cost per attendance of the day in the different types of health facility is in a standard system to project drug costs in similar types of facilities in the target system. This method does not estimate quantities of individuals seen later. It's used to estimate financial requirements. The steps in quantification, you establish the category of facilities, determine the number of each category, and then you determine the patient contact denominators for each type of facility, and compile estimate the average number of patient contact of each type and each category of facility. Where we have average cost per contact, that is the total drug purchased divided by total attendance or bed days. You calculate the total projected drug cost by multiplying the average number of patient contact for each facility by the number of facility and average drug cost. If you want to reconcile, to make reconciliation or adjustment of demand with the budget, sometimes you can have ushobora kugira amafaranga make ukavuga uti ese ndahera kuki ngura imiti ndi bugure myinshi ni iyihe, mu rugero niyo twashakaga. Ushobora kuba amafaranga ufite atari bugure imiti yose mukeneye mwamaze kwidentifyinga abarwayi bakoresha, ariko ukavuga uti ntabwo twahagarara tutaguze some medication. Iyo decision rero uri gufate iragira impact, ishobora kugira impact iri negative, ugasanga hari imiti ukuyemo yari very important. Niyo mpamvu icyo gihe hari uburyo ukoresha iya mbere niyo bita vein analysis. Vein analysis urafata ya liste yose yawe y'imiti ukore drugs uzigabanyemo ibice bitatu ushingiye kuri impact y'ubuzima yigiraho. Vital, vein bivuga ngo vital, essential and non-essential. Non-essential ni normal use categories. Vital drugs, those are medication which are potentially life-saving and which have a significant withdrawal effect and crucial to providing basic health services. Essential drugs, those are effective against the severe but nevertheless significant forms of illness, not absolutely vital to providing basic health services, and not absolutely vital to providing basic health services. And the N, that is non-essential, is used for minor and self-limiting illness. If you want to conduct the vein analysis, vital, essential, non-essential medication, you are going to classify all drugs that you have as V, E, or N. You are going to analyze any item where possible by reducing quantities to purchase or eliminate purchases entirely. Imiti iri muri class ya N iriya twise non-essential ushobora kuyigabanya quantities cyangwa se ukanayikuramo kuko igihe itari mu kigo nta kibazo kinini yateza. And limit therapeutic duplication if any. Ukareba imiti ishobora kuvura indwara imwe, ari umuti, hari imiti iri muri groupe thérapeutique imwe ishobora kuvura indwara imwe. Icyo gihe ushobora kubireba ukarimitinga iyo therapeutic duplication ishobora kubamo. Reconsider proposed purchased quantities and find additional funds aho bikeneye ukaba washaka franga. Ubundi buryo ushobora gukoresha muri reconciliation kugira ngo umenye imiti wagura igihe ufite budget ntoya, ushobora gukoresha iyo bita ABC analysis. ABC analysis, that's the method for determining and comparing drug cost. Bwa mbere wabanje n'imiti ivura, iyi ngiyi ushobora gukorera kugira ngo urebe igiciro cy'imiti. This ABC identifies three useful tiers of analysis. This class A items, imiti that is highly annual usage, high volume and or high cost. Imiti irakoreshwa cyane ifite n'igiciro kiri hejuru, usually account 10 to 20% of item ordered and 70 to 80% of funds. Izi usanga ariyo itwara amafaranga menshi. Class B usanga ari moderately annual usage, hagati ya 10 to 20% for items, so that 50 to 20% of funds. Noneho ya mbere urabona iratwara 70 to 8% of the funds. Ya kabiri muri moderate iratwara nka 15 to 20. C ibiri hasi lower ishobora gutwara nka budget ya 5 to 10% y'amafaranga yose mwakoresheje mu mwaka. Ikibazo steps rero urakora liste yose y'ibintu mwaguze ubishyire muri unit cost. You have the unit cost, that is the single item cost. Consumption, share consumption quantities over a defined period of time. Calculating the value of consumption by utilizing acquisition cost. Then we're calculating a percentage of total value used by each items. Warangiza ukaranginga items with descending order by total value. steering on the top with the highest value, calculating the cumulative percentage of the total value for each items, warangiza ukagira ute ugachuzinga cutoff point, that is a cutoff that's like a minimum or average or boundaries where you can imiti yose igiye munsi y'iyo cutoff, icyo gihe ugura iyagiye hejuru y'iyo cutoff wabashije kwiha. Iyo niyo bita ABC analysis. So no gukoresha rero ya gatatu, therapeutic category analysis. Iyi ngiyi ni ya yindi ukoreshwa, nayo ikoreshwa like ABC analysis, ariko yo ifocusinga kuri cost control, so therapeutic categories that show the highest consumption and the greatest expenditures. In this approach, therapeutic category having the consecutive highest expenditures and will be looked for possible interventions. So therapeutic nayo it's like ABC analysis, ariko urareba muri bitewe n'ikimuti uvura, uhenzemo n'uwuhe, udahenzemo n'uwuhe, ukaba wafata uhenze cyangwa se udahenze, ukaba ari wo ubasha having the bitewe na categories urimo. So that is the end. I think the cycle is that we as we talked before, this is the complex, but you can for what we talked about the previous, you determine the item you need, you are going to select it, you identify the specifications, you are going to make an analysis and request. After order, we are going to make this delivery. After delivery, we are going also to use it. After use, it's going to be again selected and used. Thank you very much for your kind attention. If you have a question, addition, then you are welcome. Thank you. So enjoy your meal. Then we are going to meet. Have another presentation by tomorrow. Thank you. Bye bye.
Murakaza neza kuri Edutainment Official TV, tubagezaho inkuru zitandukanye zicaracara hirya no hino ku isi kuri WhatsApp, Facebook, Instagram, YouTube ndetse n'ibinyamakuru. Tutibagiwe ko tubagezaho amategeko y'umuhanda, indirimbo zituje, izisobanuye n'indirimbo zo guhimbaza Imana.